Prevention of full-scale escalation is the most important set of actions when patients and families request COVID treatments or other treatments that are not supported by evidence. It's a really tough spot. They are saying things that are difficult to hear while creating a combination for us of fear, anger, and sometimes even concerns for our own safety. Patients may be absolutely convinced that you and other clinicians, along with pharma, the federal government, CDC, and the FDA, are conspiring to withhold inexpensive treatments to assure utilization of more profitable options. And when you let them know that you don't prescribe a treatment found to be ineffective and supported by no one, a patient confirmation bias kicks in that we are indeed conspiring, and the escalation can happen super fast. Patients have fingertip access to highly charged information regarding clinical approaches to COVID. It is a tidal wave of differing opinions that fuel patient and family requests based upon information they believe to be true. This is also layered on top of patients' acute stressor of actually having COVID, paired with exhausted clinicians managing wave after wave of patients, now year after year, many of which have chosen not to be vaccinated. Is there any wonder we are seeing escalations of verbal and physical abuse of clinicians? Anger and conflict can escalate or dissipate. Much of that direction is dictated by what we do. One of the most powerful techniques is not actually calming patients, but understanding them. There's something called Miller's Law, developed by George Miller, a professor of psychology from Princeton, as part of his theory of human communication. Miller's Law says this: in order to understand what someone is telling you, it is necessary for you to assume the person is being truthful, then imagine what could be true about it. Your mindset of seeking understanding of what they believe is an essential element in de-escalation when conflicts arise. Here's some guiding principles. Again, prevention of escalation is first and foremost. But if it does climb and heat up, here are some steps to take. Number one, your safety is key. Maintain 2 arm lengths from the patient and be aware and close to an escape without actually blocking it. Blocking exits actually ramp up agitation. Number 2, remain calm with open body language facing the patient. Palms up, leaning forward, and avoid crossing your arms. We send lots of signals just how we sit and the tone that we bring. Calm, level-headedness is absolutely essential here. Number 3, ask questions, asking the patient, how can I best help? Help me understand what you need. Tell me what outcome you would like to achieve. Tell me what worries you the most. These questions unpack where the patient is coming from and can help to walk down a path of discovery that will almost certainly diffuse the angry patient. And number 4, personalize you and the team. Saying to the patient, you know what? I have an amazing team who has been going above and beyond month after month and now year after year during COVID. Let's be good to each other to help you get better. This is a powerful diffusing step and reminder to the patient that you and your team are people doing the very best you can. And number 5, recognize their frustration. Saying to the patient, I totally understand where you're coming from. I know you're super frustrated with me for not prescribing what you came in for. I get it. Believe me, if there were any evidence at all that this might work, I would, but there just isn't. So ensuring your safety, remaining calm in both your voice and your body language, seeking to understand what their truth is through your curiosity and questions, and then personalizing you and your team. Will that work to diffuse everyone? No, but those actions will work for many in de-escalating the conflict. So here's your de-escalation try this challenge. Try a de-escalation technique with a buddy. Play a patient demanding something and practice these techniques. If you have a chance, watch this tip as a group and practice as a group and provide each other feedback to prepare you to be deliberate and level-headed in this super difficult scenario. Of course, if you have an effective approach for de-escalation, let us know so we can learn from you. Thanks and good luck.